Hello, it's Dr. Rhonda Johnson. Today is Saturday, November 19th, 2022, and today I'm talking about COVID-19 health policy considerations. Well, folks, whether we want to admit it or not, politics, for better or worse, plays a critical role in health affairs. And the shift in congressional political majority will likely mean a significant change in some of President Biden's pandemic policies. Now, some of the pandemic policies that may change in 2023 are an end to the public health emergency and the national emergency declaration that goes with it, a decrease in COVID funding at the federal level, which means a decrease to state and local funds to combat COVID. We're likely to see an end to vaccine mandates for federal employees and the military, and great reductions in COVID-19 countermeasures such as free COVID testing, and this has already happened in many places, less public health workers to do community outreach, and mobile vaccination clinics. We're likely to see an end to free COVID vaccines, boosters, monoclonal antibodies, and COVID treatments such as remdesivir and Paxlovid. Now, it is my understanding that children will still be able to access COVID-19 vaccines for free following the end of the COVID-19 public health emergency, and even when federal supplies for vaccines run out through the Vaccines for Children program. Now, we're also likely to see the end to free at-home COVID tests and N95 masks, which I think has already pretty much happened. Now, states will likely lose additional Medicaid funding, so that means people can lose their Medicaid and CHIP health insurance. And we have to remember that 4 out of 10 children in the United States are covered by Medicaid. Now, some highly vocal members of Congress have indicated some of their priorities as far as health legislation and pandemic-related policies include the following: investigating the origins of the pandemic, investigation into Dr. Anthony Fauci, even though he will have retired by the end of 2022, I believe, investigations into the CDC's pandemic responsiveness, how they handled the pandemic, an investigation into how pandemic relief dollars have been spent. Now, those are just a few of the priorities that I have read in terms of the new political congressional majority. You may have heard some others. So, and I don't doubt that there will be other significant healthcare related legislation. So, folks, we just have to wait and see. That is my message today. Please be careful and take care.